Hello and welcome to the next webinar in the series brought to you by Strengthening the Heartland. I'm Amber Letcher. I'm one of the project directors, and we're really happy to have you today on this sunny afternoon, as you can see from my windows. Before we get started with our speaker, I have a couple announcements for you, just some housekeeping things. As always, you can find the handout to the presentation if you'd like to follow along. It's in your panel under the handout section. Typically, we take questions at the end of the presentation, but today there's a lot of information we'll go through, and so please feel free to write in questions as we go through the presentation. I will relay those to our speaker, and you can enter those in the questions panel at any time during the presentation. And then lastly, we do have a survey that we ask you to fill out at the end of this presentation. It's a great place for us to get feedback, and if you have recommendations for future webinars, we'd love to hear it. So the link for that will also be in the chat box in your panel. And so with that, I will introduce our speaker for today. This is Amber Leafstedt. She is a behavioral health clinician at Brookings Behavioral Health and Wellness. And welcome, Amber. We're happy to have you.
Thanks, Dr. Letcher. Hello, everybody. As Dr. Letcher said, my name is Amber Leafstedt, and I currently work at Brookings Behavioral Health and Wellness here in Brookings. But I have a history of working in various agencies at various levels of care throughout South Dakota, including an outpatient agency, inpatient agency, as well as working at admissions, which will kind of tie into what we're going to be talking today, which is basically how to navigate substance use treatment in South Dakota. And while Strengthen the Heartland does address both in North Dakota, South Dakota, and just generally the Midwest rural area, my main experience has been with South Dakota, and so I feel I can speak from an informed place in regards to that. That does not mean any of the information here does not also translate to North Dakota, just that it is very specialized to South Dakota. Some of the online resources and other general information does apply. We would like to be able to connect with someone who is familiar with North Dakota's maybe treatment process or funding options. And so if there is anybody who is subscribed to this or is aware of that, if you would like to be in contact with Dr. Letcher so that we can maybe be able to provide some of that specialized knowledge for the North Dakota area. So that being said, we can go ahead and kind of move into what you can expect from this webinar. So we're going to touch on some various things in regards to navigating treatment services for substance use in South Dakota and other areas. So the first part, we're going to really want to talk about kind of what does different things mean, because there's all sorts of terms and jargon and different things that are often thrown out there or discussed when we talk about substance use disorder treatment. And so it can be helpful to just kind of be aware of what do those acronyms mean, how does it connect, and just kind of getting the meaning behind those things. And then kind of move into what services are available and present in South Dakota. What kind of services is there inpatient, outpatient, or what exists within those? And then talking about how to access those services. And kind of taking us through some of the online tools, the treatment finding tools, and navigating maybe some of the resources that are available out there that can help be instructional or informational in regards to accessing services. And then kind of going to move into funding options. How do I afford treatment? And kind of discussing what that process looks like. And then ultimately going to talk a little bit about involuntary commitment and just kind of what can be done if my loved one or there's individuals in our lives who really need services and really need treatment, but at this time just are not in a place where they are insightful enough or are in a position of where they're ready for services. And so talk a little bit about resources that are available in those scenarios, as well as just kind of talking about what are some good questions to ask when you are getting involved in treatment. And so again, as Dr. Letcher said, there's going to be a lot of information here, and I'm going to try to get through it. We only have about an hour, 50 minutes to get through it. And so if there are points in time where you have a question or need clarification on some of the information I'm providing, please feel free to use the question section so that we can answer some of those for you. I will open it up at the end of every slide for questions, as well as at the very end for questions. While I have many years experience in this, I am not, all knowing. And so there may not be questions that I necessarily know the answer to, but it's definitely something that we can look into getting those answers. And again, just kind of going from my place of knowledge in regards to this. So let's jump in. And so to start, just kind of wanted a little refresher for us going into it of kind of what addiction is. For those of us who are professionals, we probably work with this consistently, but for maybe other people, it is good to kind of remember some of that information. So we're going to watch a very short video.
A lot of us have an idea in our heads about what a person addicted to drugs looks like, but the truth is, anyone can become addicted to drugs. Addiction is when you feel a strong urge to keep taking a drug, even if it is causing harm. To stop, ask for help. Drug addiction doesn't depend on your income, your job, your age, race, or color. Addiction is a disease of the brain, and it can happen to anyone. You probably already know that you can become addicted to tobacco, alcohol, and illegal drugs. But even prescription drugs can be addictive when not taken as directed or when you take medication not prescribed for you. There are scientists who study drug abuse. Their research has taught us a lot about what makes you more likely to become addicted to drugs. Things like having family members who have had a drug problem, starting drugs at a young age, having mental health problems like depression, or hanging around other people who use drugs, all put you at risk. But you do not become addicted if you don't take drugs. If you or someone you love has a problem, get help. And if you do become addicted, you can be treated and you can recover. Find drug treatment near you.
Okay, so just kind of a really brief reminder of kind of what addiction is. It affects everybody regardless of socioeconomic status. It can affect people who are started out taking prescription medication, depending on the medication. And so really just wanted to emphasize that anybody can become addicted, and that if you do become addicted, that there is help available, which is kind of the theme of this webinar. Is there's help out there, there's resources out there. So how do I access them? How do I know what is available?
Call 1-800.
So we're going to go through kind of those terms and different terms that we talked about and kind of what it means. So the first one to talk about is an assessment. So there's various terms that are used when we talk about assessments. Some people call them treatment needs assessments. That's kind of an old school term. Substance use disorder assessment. And along with assessments, there's also screening. So the screening process is just a very brief process that determines the likelihood that somebody might be struggling with like a substance use disorder. And the purpose of the screening is to determine whether or not further assessment is required. So screenings can be screening tools, it can be conversations with a professional. And if the likelihood of the possibility of a substance use disorder exists, then they would move on to maybe more formalized or a more formalized assessment process, which is called a treatment needs assessment or a substance use disorder assessment. And these assessments are conducted by behavioral health professionals, normally a ACT, which is a addiction counselor trainee, a CAC, which is a certified addiction counselor, or an LAC, which is a licensed addiction counselor. So those kind of terms are, people who are just becoming counselors and who are still receiving the supervision and kind of in the process of taking their test in order to become either a certified or a licensed addiction counselor. The difference between a certified addiction counselor and a licensed addiction counselor is a certified addiction counselor has a bachelor's degree. a licensed addiction counselor has a master's degree. So all qualified in order to provide assessment services and individualized or group services. So that's what that means. The next one is co-occurring. So co-occurring disorders basically mean that mental health conditions are in combination with substance use disorder, or substance use disorder in combination with disabilities, right? So it's these two things that are occurring together. So they are co-occurring. And not all programs offer services for co-occurring. Some programs do offer services that are specialized in providing co-occurring services. Most of those services for co-occurring are mental health and substance use, so normally includes psychiatric staff and mental health services in connection with the substance use services. So intervention and involuntary commitment, we're going to talk a little bit more heavily on this in coming slides, so I'm not going to talk too much here, but an intervention is when an individual who is struggling with some sort of substance use disorder, family members or other loved ones kind of come together to try to intervene in kind of the cycle and the process of their addiction in order to get them help. And an involuntary commitment is those loved ones stepping in to get kind of an outside entity to come in and kind of help that loved one kind of seek those services. Again, we're going to talk a little bit more in depth about it. So accredited, so different programs that we're going to talk about today while we access the online resources might say like funding available or state accredited. And so what that means is basically they are accredited through the state of South Dakota in order to provide services and access state funding options. They are overseen by the state. They get assessed and kind of accredited on a regular basis by the state that they're providing quality services and kind of meeting the standards. And then medication assisted treatment. So this is a form of treating substance use disorders that is not strictly abstinence based. It's more of a harm reduction kind of outlook on medication assisted treatment. I am not super well versed in this, so I did find a video that will hopefully explain it a little bit better than I am. So we are not associated with the agency that is in this video. I just thought this doctor did a very good job of kind of going through some helpful information about medication assisted treatment. But again, we are not associated with the Coalition Recovery.
I'm Dr. Deborah Barnett. I'm a psychiatrist. I'm board certified in general psychiatry, forensic psychiatry, geriatric psychiatry, and of course, addiction psychiatry. So MAT has typically referred to the phrase medication-assisted treatment. The more appropriate phrasing, however, might be medication for addiction treatment because it is, in some instances, the heart and soul of addiction treatment. Addiction treatments in the form of medications came out in the, even before the 1990s. We have some of the older treatments for alcohol, for maintenance of abstinence from alcohol. It is not appropriate probably to think about these medications as anti-craving medications. Anti-craving effect can be a secondary issue. However, the primary issue with the medications and the primary goal has been to improve the chance of success at recovery, that is, maintaining abstinence. The medications largely became available in the 1990s, even though many people have not heard about them or even know that they're available. A quick note about the efficacy of the medications that we use to treat addiction, or the medications that help promote recovery and abstinence in people who have alcohol use disorders or opioid use disorders. Without the medications, but with the usual kinds of treatments and therapies that people engage in, the chance of success might be, unfortunately, relatively low. And for some programs and for some types of therapies, maybe only 15, 20, 25% chance of maintaining your recovery. However, when you combine all of these modalities, including the medications, your chance of success increases to about 75%. And that would be over.
And I just want to say I did not double check her statistics with other research, so I cannot confirm those statistics.
The course of a year. We have medications that are available to treat alcohol dependence or alcohol use disorder, as well as opioid dependence. Generally speaking, these medications are quite safe. However, having said that, there is the potential for people to overtake the medication, especially if they're not used to taking opioids, in which case it would have an effect that is similar to an opioid. By the same token, we wouldn't want a child or a baby to inadvertently take the medication, because that would be dangerous as well. There are a couple of different approaches to taking products that contain buprenorphine or any medication-assisted treatment. The question often arises, is it something that you want to take short-term, that is for detoxification only, or is it something that you want to use for maintenance, either short-term or long-term? A lot of people do prefer buprenorphine-containing products for their detoxification because it does certainly provide a more comfortable detoxification. However, in the long run, probably doesn't improve your chance of success any more than detoxifying with, say, clonidine. So it is recommended that people maintain on some form of medication, whether it is a buprenorphine-containing product or some other medication, to help promote their abstinence and recovery. Generally speaking, time frame on buprenorphine-containing product like Suboxone would be on the order of several months or perhaps a year or more. It really depends on the individual. So, for example, is the opioid dependence something that has been short-term or long-term? How long has been the struggle to stay off of opioids? Is it something that runs in the family? There are many, many factors that I take into consideration when I'm counseling a particular patient about when it's time to try to come off of the medication.
Okay, so hopefully some of that information is helpful in kind of describing a little bit about what MAT programming is. Again, not associated with the agency, and also didn't cross-reference her statistics there in regards to efficacy of traditional treatment on its own in comparison with MAT programming. And good MAT programming will be in connection with counseling. So it's not just the medication, it is counseling and treatment services in connection with the medication, as she also stated. So intensive methamphetamine treatment is a evidence-based treatment programming that is available in South Dakota through differing entities and with state funding. So the intensive methamphetamine treatment, or IMT services, offer long-term evidence-based programming to individuals with severe methamphetamine use disorders. Individuals who receive IMT services required extended treatment to allow for recovery of cognitive capacities, as well as ongoing case management. So the way that this typically looks is individuals will receive either intensive inpatient treatment or low intensity residential treatment. So like a 3.7 or a 2.5 level of care, which we're going to talk about next of what all that means. So they complete a 30 to 45 day inpatient or low intensity residential programming, and are then transitioned into a continuing care program, which normally is like a halfway house, sober living, for continued long-term services. And it's a long-term step down program because research has shown us the longer we can keep people involved in services and treatment, the higher their chances of recovery are. And especially with methamphetamine, having kind of that longevity of services is effective. MRT is moral recognition therapy. I never say that second word right. And MRT is available through the SJI services in South Dakota, along with SBISA, which is cognitive behavioral interventions for substance abuse. So Both of these are treatment programs that are based in cognitive behavioral therapy. They have phases, they have modules is what they are called, and they tend to be kind of a step-by-step program, and they are mostly provided on an outpatient basis. At different places you might see them also available in connection elsewhere, but for the most part these are through the SJI here in South Dakota. Okay. So I do have a link here, and it's in a future slide. We're also going to show you how to access this, not just through this link. But this is a behavioral health quick reference guide that is available on the DSS website, and it has a lot of the information that I just gave you in regards to accessing services. So kind of in regards to like, what are these terms, you know, what is co-occurring, what is a substance use disorder, what is behavioral health, as well as screening, assessment, treatments, right? What do all these terms mean? So this is a really good guide, whether it be for professionals to provide to individuals and families in regards to kind of introducing them to these services, or even for professionals to kind of reference in general, or even individuals from the public knowing kind of where to access this for this information. And again, explaining what LACs, CACs are, and how to access these services. I found this guide to be very helpful, and it has further explanation here. Also has some of the resources we're going to go through in regards to agencies, counties that they serve. We're going to have another resource available. So as we're coming down to the end of the slide of kind of this aspect of what, you know, what does it all mean? Have we had any questions, or are there any questions about this so far?
There's no questions in the box yet, but again, feel free if anybody would like to type them in as we go, and I can let Amber know.
Perfect. So moving on to kind of the next aspect of what does it mean, we're going to talk a little bit about levels of care. So what levels of care really mean is basically the intensity of services. So is it community-based outpatient? Is it prevention services, the slip slot, or inpatient? So the intensity, it also is gauged on a professional level based on the hours given of service, right? So the less intense the level of care, the less hours of services. So to kind of go through this, so for outpatient level of care, you have prevention services, which is also 0.5. So these are things that are for individuals who need like education. So might do some prevention services at the like early intervention stage, so to high schoolers, to college students, or even to individuals who have gotten a DUI. So DUI classes could almost be considered a prevention service as well. So people who have use-related problems, but they have not been diagnosed with a substance use disorder, are appropriate for these services. And then at the next level for outpatient is level 1.0, which can be either on an individual or a group basis. And so these are services that are provided at the community level and are less than the intensive outpatient. So level 2.1 is intensive outpatient, which is group, and it is at least 3 hours, 3 times a week. So as you're kind of seeing, we are increasing in intensity of the services of no substance use disorder diagnosis for prevention, which is normally a class or 2, and then to level 1.0, which can be like individual counseling or on a group basis, up to the intensive outpatient, which is increasing in hours and intensity. And then we get to the kind of the in-between. So these are normally accessed after an inpatient stay, not always, but traditionally that is what I've seen. And these are things like halfway houses, sober living, day programs less so in between. That might be the next step up. And low intensity residential treatment services is another term used for these programs. So halfway houses are sober living houses, are places for individuals with substance use disorder diagnoses to live and stay at, normally following an inpatient treatment stay. Their length of stay at the halfway house is really dependent on kind of what their continuing care plan is. Normally, the entity or agencies they are leaving from will help set up kind of a plan for them, and they're involved in that plan in deciding kind of their length of stay. Day programs are treatment services provided to adults diagnosed with substance use disorders in a structured intensive treatment program. And this can include residential, a residential component, but not always. And we'll have an example of that as we kind of go through what is available in South Dakota. And then finally, inpatient programming. It's also called level 3.7, intensive medically monitored treatment. Also, inpatient treatment for adolescents oftentimes will be called PRTF, which is a psychiatric residential treatment facility. Even though it's for substance use, it is still called the PRTF, and that's also related to the funding in regards to like funding assistance. There's specialized programs for pregnant women and women with children at 3.7 in the state. We talked a little bit about the IMT program already. And then detox. An important thing to note for detox is that there are standalone detox. So centers and agencies where you can access just detox services. You go in for your detox and then you're able to just detox and move on. And then there are other services that provide detox, but it is program based. So you go in, you detox, and you complete a program, like a 30 to 45 day program. It would not be coming in for the few days to detox and then moving on. So a resource that we have also from the DSS website, and we are going to again show you where to access those, but it kind of fit with these pages, so I wanted to make sure that we touched on them here. So this is a resource available from DSS that indicates all of the agencies in South Dakota, kind of has the little star for whether or not funding assistance is available, which means it is an accredited program. The communities that it serves, and then kind of an X for what type of services that they are offering, as well as some contact information. I do want to note, however, that Strengthen the Heartland, we are going to be putting together a comprehensive list from this list because it is noted that there are some inaccuracies on this list. And so one thing I'm also going to emphasize, if you are looking either as a professional or as kind of an individual or a loved one trying to access somebody's services, it is best to call and ask questions, which we're going to talk a little bit about later, just to confirm whether or not these services that you are hoping to access are in fact available. And the only reason I know that is because for my current employer, Brookings Behavioral Health and Wellness, we do not offer every single one of these services. And so we will be working towards providing a more comprehensive service for this. So this is still a very good resource. It has the contact information, it has the levels of care that is provided, as well as kind of what communities it provides services to. Okay, so these are some of those terms, again, that might be used by professionals or others as you are kind of working towards accessing services or trying to determine what services are right for me or my loved one. So in regards to what is available in South Dakota, so for inpatient treatment, currently there is Stepping Stones in Mitchell, South Dakota, Dakota Pride in Sisseton, the Human Services Center in Yankton, Keystone Treatment Center in South Dakota, or in Canton, Lewis and Clark Behavioral Health Services in Yankton opened up a inpatient unit, and Compass Point has one out west. VOA has New Start for pregnant women and mothers, as well as Behavioral Management Systems out in Rapid City has Full Circle for pregnant women and women with dependent children. And then as far as adolescent programming, we have Keystone Treatment Center also has their adolescent programming. Our home in Huron, Volunteers of America in Sioux Falls, and then Wellsprings in Rapid City is listed as an adolescent program as well out West River. Okay. So navigating online resources. So as mentioned before, those two resources that we talked about available on DSS, it is actually here that we access them. So these two resources right here are those two that we went through, which is the brochure for behavioral health services and the list of treatment agencies and the services that they provide. So then another good resource is identifying treatment providers in your area. It will take you to this handy little map of counties. And then you can just go ahead and click on your county. And it's going to take you to the resources that are available in that county. So for Sully, it is Capital Area Counseling, right? And it will take you right to that resource in regards to kind of accessing those services. And then you can get yourself more information. It is also good to be able to kind of cross-reference some of these in regards to kind of what was offered. So if you're saying, okay, well, this is saying this is what's close to me, well, I need inpatient. Is it an inpatient? We have that other list that we looked at that says exactly what the services are that you can reference as well. So this is a nice little map, but it is also good to, again, cross-reference the other information that has been provided, as well as just being in contact with the agency and the entity in order to determine whether or not it is exactly what you are looking for. The other thing is that it has this additional information in regards to the IMT programs, DUIs, and other resources. And then the findingtreatment.gov. So this is basically a search engine for treatment services, and you can type in your zip code and it will take you to this, and it's going to connect you. It still has us listed as East Central Behavioral Health. We are Brookings Behavioral Health and Wellness now, but it at least is going to point you in the right direction. Now, for South Dakota, it might include things such as the Flanders Santee Sioux Tribe or the VA or other Indian Health Services. And it is important to note that some of these entities are specialized in the populations in which they serve. And so it might not be services that are available to all community members. And so whether as a professional or as an individual, it is important to note where you are sending people and whether or not that agency or that entity is a specialized services entity, such as the VA, if you are not a veteran or in connection with a veteran. Chances are you are not going to be able to access services at that entity. Again, it is always helpful to call and kind of confirm whether or not those services might be right for you or your loved one. So with this with this thing. So I can put in how far away I am willing to travel in order to receive services. And that is going to increase my my options because it's further distance. And so that can kind of be helpful sometimes, especially living in rural South Dakota of, well, I don't have an agency right in my immediate community, right? But I'm able to travel 25 miles, 50 miles, whatever it happens to be in order to access these services. And then it has these options for whether I'm wanting outpatient or detox, where it's going to point me in the direction of those services. Along with the DSS website and those resources, there is the SAMHSA website, which is Substance Abuse and Mental Health Service Administration. It's very similar in its format, but it is looks a little bit more intimidating in regards to kind of the information it provides. So it's going to list, I just typed in South Dakota, so it's going to list everything. And it's going to, you know, the point miles. And so it's also gives these options up here of, I'm just looking for substance use. So since it is the Substance Abuse and Mental Health Services Administration, it's going to give you every resource, right? And so you can specify what you're looking for. I'm looking for substance use, right? So I'm looking for that detox, the transitional, so that that slip slat, that 2.1, 2.5, and hospital, inpatient, residential, service settings, so levels of care. So all of those things that we already kind of talked about, that you can kind of specify that that is what you're looking for. With the SAMHSA website, and I think I saw it there, in regards to the medication assisted treatment, right? You can look for and search for practitioners who are able to provide those services and provide you with that information, and who you can seek more information from in regards to accessing those. It is a little bit more intimidating. There's a lot more boxes, a lot more information, but it also has the directions, the websites, as well as giving you some more information in regards to like the type of care, service settings, and whether or not they have these things, right? And it might, again, direct you to things such as the Indian Health Services. And so remembering that certain populations can access certain things. So if we look at Sioux Falls, which is one of the major hubs, right, it's going to hopefully populate and give us that information, right, about what is available in that area. And I can, again, increase my miles. So 25 miles, right? 100 miles, right? And it's gonna start giving me more and more options. And this can be helpful if you are in let's say rural, where you might not necessarily have something immediately in your community. So in Salem, they don't have anything within 5 miles, right? But that doesn't mean that there isn't something nearby. So within a 25-mile distance, they got community counseling services in Madison, right? And so this tool can be helpful to help make those services appear and be reassured that they are accessible, that they are there and they are available. to us. And again, can get more information. Okay, so what is available, right? What is this facility going to be able to provide me, right? So even payment, right? So it's a sliding scale fee. So my fee is based on my income and other factors, right? So helpful information in regards to accessing these services and utilizing these online resources of what is out there in regards to services. Okay. So the admission process. So I now know I want to access services. I know how to use online resources. What's it going to look like, right? So as far as accessing those services, a admission appointment can be scheduled by yourself or by a loved one. So you can call the agency, whether it be an outpatient, inpatient, or otherwise, and you can call them and say, I need services, my loved one needs services, right? And you can ask their admission staff questions in regards to what that process looks like. And for each entity and each agency, it's probably going to be a little bit different. But in general, it's calling and scheduling that appointment. Some centers may allow walk-ins. So your loved one is saying they are wanting help right now, or you're saying, I'm ready. I need to go now, because that motivation is high and you're ready to act on it. Some centers do allow walk-ins where you can present yourself to their doors and access services. That is not all, but many do. And so again, it might be calling them, talking to them and saying, I want to walk in today. I need services today. And then also getting a referral through a community provider or through an assessment. So if you're trying to access inpatient treatment services, maybe you receive an assessment at your local community mental health center from a substance use provider, and they do an assessment with you and they refer you to inpatient or outpatient services, right? That provider will help you through that process by providing that information and that continuity of care to these agencies. Because ideally, that is what we want, is continuity of care from the lowest level of care to the most intensive and then back down. We want to have that process because, as we talked about with the MIT, right, that continuity of care and that longevity of care is what can increase the effectiveness and the success rate for treatment services. Most, if not all, agencies, especially at the inpatient level of care or low intensity residential level of care, is going to have an admissions office. They're going to have staff who it is their entire job to assist with the admissions process, to answer questions, to work with other agencies and entities in regards to admission and referral. And so they are more than welcome and ready to help with that. I worked for a inpatient residential program here in South Dakota in that admissions office during my time as a counselor, and they're able to help with things such as finances, right? So funding options, right? So private pay is one option. That is where you just pay for your services, right? You're not trying to go through insurance. You're not trying to go through anything. You're just saying, I'm just going to pay out of my pocket for these services. But many insurances nowadays are covering substance abuse services. And in order to kind of determine whether or not your insurance, you do have benefits, what those benefits look like, co-pays and all that stuff, you can check your plan yourself. You got numbers on the back of your insurance card. Also, many admissions offices will help you determine what your insurance coverage is. You can call them, provide the information, do a verbal release of saying, yes, I want you to check in on my benefits. And they sometimes do that for you. I know at least the admissions office that I worked for did. And then they can help you understand what those benefits are and what that's going to look like in regards to your ability to afford and access services. And here in South Dakota, we do have state funding assistance for all levels of care. So for accredited providers. So not all agencies are going to be accredited. So if you remember, we were looking on those resources and those websites, they had the little asterisk that said funding available. So that funding available means that it's an accredited provider and they are able to access and receive state funding for their services to individuals who qualify. If it does not have that funding available, chances are they are not an accredited provider and cannot access those funds. So the state funding process is based on income. There's a form called a means 101 that agencies who are accredited and able to provide funding or referral to funding services that are funded will have you fill out and they go through it with you. It looks like a really confusing form, but the staff are able to help you understand and access and determine whether or not you are eligible for that funding. And for the rest of this is really going to be for inpatient. So I want to kind of take a step back and talk a little bit about outpatient. So as far as that funding goes, if you are eligible for state funding, when you fill out that means form, you are able to access those services. So on the outpatient level, it doesn't require any pre-authorization or approval by any state agency or entity. However, if you are attempting to access inpatient level services, so 3.7 services, you do require prior approval by the state. And so how that is determined and completed is you receive an assessment from an accredited provider who is going to determine your appropriateness for a level of care. So they're going to do the assessment, and it's based on things such as severity of use. If you're an IV user, are you a high-risk individual, so pregnant, your withdrawal potential. Other factors that they take into consideration is whether or not your use or a client's use is causing imminent risk to their health or imminent risk to their emotional or behavioral health. Whether or not they have support in their environment, their stage of change. So all of these different factors kind of determine whether or not somebody is appropriate. And so the professional will do the assessment and submit paperwork to the Department of Behavioral Health, and they have a high intensity referral team, which is made up of LACs, CACs who review the information and will either approve or deny your need for, whether or not you're appropriate for that level of care. And then from there, they send approved applicants to programs in the state who are accredited for state funding, and then it's reviewed by their admissions office, who then accepts individuals into their program, and you get a bed date. Your provider will help set that up for you, and then you attend and you hopefully complete services. I do want to note for adolescent treatment services, they do require a doctor's letter that notes that there is a medical necessity for treatment services. So that is a requirement to be admitted into for state funding for services for an adolescent. So in South Dakota, there are funding options. Inability to afford services is not a barrier for you to be able to access these services. There are accredited providers, most community mental health providers that are responsible for providing services in certain communities, normally within counties, are accredited through the state. And so those state funding options are available. And there are many, many more who have sliding scale fees in order to make these services affordable. Okay, so intervention and involuntary commitment. So interventions can be beneficial if done correctly. And if you're going to use an interventionist, my suggestion is just to do your research, ask questions, talk to them about it, and just kind of get as much information in regards to whoever you're utilizing for your intervention. And then ultimately stick to whatever boundaries you set. If you're completing an intervention with your loved one, if you say we're not going to continue to support your addiction, just make sure whatever boundaries you set, you are comfortable with and you are willing and able to stick to. So this is a resource for the involuntary commitment process here in South Dakota. So there is a process set in place to help get individuals who are struggling with addiction help, even when they are maybe kind of trapped in their addiction and are unwilling to kind of help themselves, even though it is putting them at risk and in danger. So I'm just going to give kind of the short thing, kind of short explanation, very brief. It is much more complicated than these little points are going to be making, but we're going to go to the resources that have the much more detailed information. So basically, an involuntary commitment or a petition must be filed by somebody with personal knowledge. In South Dakota, generally, they want that to be loved ones or individuals from that person's life. They don't really want it to be like a professional or an outside person. They really want somebody with true firsthand knowledge. It's filed with the county clerk of courts of the county in which the individual lives. Once it is filed, individual and the individual that it's filed against and the petitioner will get a lawyer to represent them. The individual who is struggling with addiction will be assessed by an accredited professional who will make recommendations in regard to treatment, the treatment need. Eventually it is a court appearance in front of a judge who ultimately makes a determination. And if it is approved, the court will then mandate that the individual attend and complete treatment services. So let's go ahead and look at this resource. So there's a couple of different resources here, both for loved ones and professionals. So they also have the mental health options, but we are going to go ahead and scroll down here to substance use. So they have the statutory criteria here if you're interested in reading that. But the really helpful resources here are the roadmap for involuntary commitment for professionals, and then the roadmap for family members. So this is really detailed. It's multiple pages. It's an entire packet. A nice little brief overview here is the brochure as well, which is easily accessible and is an easy handout to provide to families if you are a professional. So you're not handing them this big book of like, here you go, here's all this overwhelming information. This is a nice, very brief informational handout in regards to what this process looks like. So it talks about the funding, how services are determined, and as well as, again, redirecting to what services are available. And so here, some of those things that I talked about, the hearing, right? So any responsible person can apply for the petition. The county clerk of courts, what the application process looks like, the hearing, right? And then the commitment process. As well as it talks about who's really appropriate for an SUD commitment. Not everybody who is currently and actively using is appropriate for a commitment, right? So for people who are appropriate are people who have threatened, attempted, or inflicted harm on themselves or others. And that unless something is done, they're likely to continue that behavior. People who are incapacitated because of their use, people who are pregnant and are using. So people who are having significant risk because of their use and are unwilling or unable to stop on their own, or are unwilling or unable to access those services. Okay, so just wanted to touch kind of briefly on kind of what questions are helpful questions to ask when you're researching or looking into a treatment option. Because as I've said a couple of times throughout this webinar is call, ask questions, right? They have staff, they have individuals who are set and ready to answer those questions for you. They want to help you or your loved one access services, right? And so these are some helpful questions that you can consider asking them. Financial assistance. So provided some information to you right now, but ask them, is there financial assistance? Do you do payment plans? Are there copays? Because even when you have state funding, sometimes there are copays, right? And so you can even ask them about hardship, right? There are plenty of agencies and plenty of options that are available to reduce the barriers that are there for services. And a lot of the times, all you have to do is ask. Length of stay of the program. or what programming they offer. So you can call and say, I'm looking for community-based program, because not all agencies, if they have outpatient services, have intensive outpatient treatment. They might just have outpatient, they might just have early intervention services. And so sometimes it's important to ask, what services can I actually get here? Or this is what I'm looking for. Do you offer this? And then length of stay for inpatient, it might be 30, 45, 90. So kind of knowing what you're getting into, or knowing what is available, knowing I want longer term. Is that something you offer? Detox, so asking, is it limited in beds or substance? So there are some agencies such as the Addiction Care Center in Aberdeen, which is through Avera, who they have 2 beds for their detox. And so if you're attempting to get somebody there, get your loved one there, get there yourself, it might be important to call them and say, like, I'm gonna need detox. Like, are there detox beds available? And they might not be. There is an agency who only really offers detox for alcohol. They're limited in their ability to offer detox services for other substances, whether that be opiates, benzodiazepines, or others. So it's important to ask questions. So they might have detox, but is it going to be available or able to help me with the kind of detox that I need or that this client needs? Continuing care plans or programming. So continuity of care. Some agencies, such as Stepping Stones in Mitchell, has the ability to do both 3.7 and then slip slot, right? So they have that continuity of care within their agency. For other agencies, they might have to refer you to a new program, and there's still the availability there for continuity of care, but it's sometimes important to kind of know, am I going to be able to get a full spectrum of services that I am wanting? Asking about open beds or wait lists, right? How long am I going to have to wait in order to access these services? Do I get to access them right away? And then again, specialized services. So MIT, Sabisa, MRT, MAT programming, or even specialized populations, again, with the VA and IHS. So kind of asking those questions of, is there any specialized service going on? And so kind of a lot of information, a lot of good information, a lot of resources that are all out there. And so kind of want to open it up to any questions. I didn't see Dr. Letcher interrupting me, so I'm assuming we didn't have any throughout, which is okay, but want to maybe open it up for any questions as we're coming here to the end.
Yes, feel free to type those in. A lot of great information. It can seem a little overwhelming, so I can definitely see how people might have a little bit of difficulty navigating through that treatment. But I think your advice is excellent, to call people and ask questions, and the tools are really valuable to get you started. And you never know, services might be added somewhere, and so it's never a bad idea to give them a call if needed. As we give a couple minutes in case somebody's typing, I'll go through a few just wrap-up announcements. So please feel free to fill out that survey link. We like your feedback. As Amber mentioned, we'd love to do a more North Dakota focused treatment webinar as well. So if you have a contact, or if that's you, we would love to meet with you. And also, we do have a YouTube channel that has all of the recordings of our past webinars, and this one will also be posted there. So you can find our channel, just Strengthening the Heartland, if you search YouTube. And I don't see any questions popping up, but it is a Friday afternoon, so that makes sense. We will make this handout available to you. And then also, Amber, I wondered, you showed some other websites with some information. So if you'll share those with us, we'll send them out in the email when we send out the recording of this webinar.
Sounds good.
Wonderful. Well, have a great day, and thank you. We'll see you at the next webinar.